On behalf of the City of Dallas leadership team, I want to thank you for taking the time to attend this very important session. For those of you that are watching the tape, I want to thank you for logging on. My name is Michael Mendoza, and I serve in the Office of the City Manager. I serve there as Chief of Economic Development and Neighborhood Services. And this is day 38, so I've actually not served there very long. And I'm very happy to be here because I too have questions about the health benefits and some of the plans coming up. My whole family does. So thank you very much for organizing this event. So as we all know, there have been a number of changes and enhancement to our health plans, and changes often accompanied by many challenges and lots of questions. These employee benefit information sessions were created so that our staff here could respond to any questions that you might have regarding the current health plan, and to give you a glimpse of what will be available in 2020 pending City Council's approval. I'm also pleased to share with you that this presentation, along with a recording of this and I think the previous session in Spanish, will be available on the HR Benefits website for you as employees to view if you were not able to join us for this live session. Look for that information to be available via the HR Benefits site after May 31st. Again, we thank you, and now I want to turn the program over to Ms. Cheryl Mayo Williams, our Health Benefits Contracts Administrator, and enjoy the program.
So at this time, we are actually going to bring up a representative from Holmes Murphy, Ms. Nikki Morgan, who is going to go through an overview of our current plans, as well as some enhancements that we've made to our 2020 plans. We're going to talk a little bit about cost, and then I'll come back and close us out as far as the benefits portion. Then we'll move into engagement, which I'm sure all of you all want to hear more about. So Nikki, do you want to come forward at this time? And thank you so much for being here as well.
Thank you very much for having me. I'm Nikki Morgan with Holmes Murphy. And as you know, there have been a number of changes to your health plans. And so the goal of the City of Dallas is not only to improve the quality of your health plan, but ultimately your health, because we want you to be here at City of Dallas for as long as possible. So what we're going to do today is talk about your benefits that are in place today, and then some of the proposed enhancements for 2020. So the City of Dallas has been very strategically focused on your health care. They've put that into 4 buckets. So the first one is to manage the costs long term. As you know, healthcare costs continue to rise, and so to manage that cost is very important. And they do that through targeted programs. So that partially is going to be by the plan designs that they offer, like the HSA plan and the premium copay plan. They also want to improve healthcare consumerism, to let you know that just because everyone's in network doesn't mean that every doctor or facility charges the same amount for those services. And so to make sure you have the tools available to be a healthcare consumer. We also want to promote preventive care. Preventive care on all 3 plans that you're offered is covered at 100%. So we want to make sure that everyone that is enrolled in one of the benefit plans is at least having 1 claim a year, at least getting that preventive visit in. And then we also want to make sure that you have choice and options for personal accountability. So that's why you have 3 plans to choose from, so that you have the choice to choose which plan is best for you and your family. So we've already gone through the welcome and introductions. We're going to talk about your 2019 benefits, talk about some of the proposed enhancements for 2020. We'll also talk about employee engagement opportunities, and then we'll have closing remarks. So first, let's talk about the plans that you have in place today. All of your medical plans are offered through Cigna Healthcare. You have 3 medical plan options. You have the high deductible health plan you have your HRA plan, which has a $2,500 individual deductible. As we mentioned before, your preventive care and your on-site clinic have a $0 copay. When you go to any office visit, whether it's a primary care physician or whether it's a specialist, you're going to be responsible for 25% after you've met that $2,500 deductible. The same also applies when you go to urgent care, so if you need after-hour care. Your emergency room is subject to a $250 copay, and then it's also subject to your 25% coinsurance and that $2,500 deductible. And then any labs or x-rays that you have are going to be subject to your deductible and then your 25% coinsurance. If you do have prescriptions that you need to take, if you are taking a generic prescription, you're going to pay 10% of that prescription after you've met your $2,500 deductible. Preferred brand name has a 25% coinsurance share after the deductible, and then your non-preferred brand name has a 40% coinsurance share after your $2,500 deductible. If you're enrolled in the HRA plan, you also get a contribution from the City of Dallas of $700 toward your health reimbursement account. So the next plan option that you have, option 2, is your premium copay plan. That plan sits on the Local Plus network, which is a high-performance network. That Local Plus network targets the most high-performing both physicians and facilities. So you'll notice that it's smaller than the open access network available on the HRA plan, but that's because they're steering you toward more high-performing providers and facilities. On that plan, you have a $2,000 deductible as an individual, $0 copay if you seek care either from your preventive care or from the on-site clinic. If you go to a primary care physician, you have a $25 copay. Your primary care physicians are going to be your internal medicine doctors, your family practitioners, your general practitioners, and then for any children that you may have covered under the plan, their pediatrician. If you choose to seek care from a specialist, you do not need to get a referral, but you will pay a $50 copay. Any specialist is basically any doctor that has IST on the end of their practice. So whether it's dermatologist, cardiologist, if they have an IST on the end, generally that means that they are a specialist and you're going to be subject to a $50 copay as long as they're in network. If you need to seek after-hours care, you have two options. Urgent care has a $75 copay, or if it's a true medical emergency, you can also use the emergency room. The emergency room has a $250 copay. It's also going to be subject to your $2,000 deductible, and then you're going to pay 20% coinsurance. When you have labs and x-rays, those are going to be subject to the appropriate copays, either $25 or $50. If you have a prescription that you take, this copay plan has a separate prescription deductible that applies. So that means you're going to pay the first $750 for any prescriptions that you need to take. After you've met that $750 pharmacy deductible, your generic prescriptions, you're going to pay a 10% coinsurance. Your preferred brand name, you're going to pay a 25% coinsurance. And your non-preferred brand name, you're going to pay a 40% coinsurance. For this particular plan, there is no health savings or health reimbursement account attached to it, so then there are no City of Dallas funds that go into those accounts because we don't have one tied to that plan. Your option 3 is going to be your high deductible health plan with an HSA or health savings account. On this plan, you'll notice all of your services, really except for your preventive care, which is always going to be covered at 100%, or whether you go to the on-site clinic, are going to be subject to your $3,000 deductible. After you've met that deductible, you're going to be responsible for 20% of those services. So whether it's a primary doctor, a specialist, urgent care, emergency room, lab and x-ray, or any prescriptions, all of those services are going to be subject to your $3,000 deductible, and then you're going to pay 20% coinsurance. On that particular plan, there is a health savings account attached to it, and the City of Dallas contributes $200 for you toward the health savings account. We have some information on the monthly premiums listed below, but we're going to go into a little more detail on some of the monthly premiums in a couple of slides. So now let's talk about some of the proposed changes for 2020. Those are highlighted here in either red or green. So the red means that it's slightly less rich than what you have today. Green means that it's going to be richer than what you have today. So I'm just going to hit those high points since we just went through in a little more detail on each one of those plans. So on your option 1, your HRA plan, the emergency room, to help improve steerage away from emergency room for truly non-medical emergency care, is going to have a $350 copay, and then subject to 25% after the deductible. And then the other proposed change, again that's pending council approval, is changing the funding to the health reimbursement account to $200 for the individual. On the premium copay plan, you see a lot of green, which is great because that means that they are really looking to improve that plan for you for 2020. So on this plan, the deductible would go to $1,500. Your primary care physician and also CVS Minute Clinics would be subject to a $25 copay. Your urgent care would be subject to a $40 copay, again, really to incentivize you to use urgent care as after-hours care, non-emergent care, instead of going to the emergency room. But the emergency room is proposed to move to a $300 flat copay. Lab and x-ray subject to a $50 copay. And then on your prescriptions, moving it again to a true copay plan. So we're moving that RX deductible and having flat copays. So for generic prescriptions, a $15 copay. For preferred brand name, a $40 copay. And for non-preferred brand name, a $75 copay. As you'll notice with the employee premiums, we have some tiering that is proposed for 2020, and so we have more information about that on the next slide. And then for your option 3, your high deductible health plan with an HSA, the proposed change is at the bottom with the City of Dallas funding toward that health reimbursement account for $700. So definitely an improved contribution by the City of Dallas to your health savings account on that plan. And again, just as a reminder, these are all pending final council approval, so not set in stone just yet. So let's talk about the premiums, because we all know that that impacts our paychecks, so that's extremely important. As you'll notice for the HRA plan, the same, really the same for all of your tiers, but that premium copay plan is really what I want to spend a little bit more time on, because you'll notice that there are 3 sets of rates. Those rates are going to be based on your salary. So the City of Dallas is really trying to make sure for any of the lower paid employees that the plan cost is appropriate for them and not out of reach for them to not only enroll in a plan but also be able to use the plan. So the first set of rates are for any employee making under $44,000. For any employee making between $44,000 and $66,000, we have a slightly higher set of rates. And then for any employee making over $66,000, then essentially it's almost the same rates that are being paid today. And then you see the proposed rates for all salary tiers for the high deductible health plan. So as all of you know from the news, I don't think anybody has heard that healthcare costs are going down. Healthcare costs continue to rise more than almost any other thing that we pay for. So keep in mind that while the City of Dallas is working really hard to make these plans affordable to you and not increasing your costs or increasing them as limitedly as possible, that doesn't mean that the City of Dallas healthcare costs are going down. They are absorbing that difference. The City of Dallas is absorbing those increases in healthcare costs on your behalf. So please keep that in mind. So let's talk about some of the plan highlights of all 3 of these plan options. Your HRA plan has the largest network with that open access network. It also has tied to it a health reimbursement account. A health reimbursement account can only be funded by your employer, so it's only funded by the City of Dallas. And as a reminder, as we've mentioned, this plan is scheduled to be phased out. So while we are listing it with changes for 2020, it is proposed to be phased out by 2021. So keep that in mind as you're making your elections when this year's open enrollment comes up. Your premium copay plan, that uses the Local Plus network. So while it is a more narrow network, it is also a more high-performing network, which means that the physicians in that network perform their practice at a higher level. That means that you don't have to go back as many times to make sure whatever condition you may be diagnosed with is taken care of. They have a record of being a higher performing physician, and then also for the facilities in that network as well. This plan has co-pays associated with it, which means that you have a little more known costs when you go to the doctor. You have that peace of mind of knowing exactly how much you're going to be responsible for paying when you go to the doctor. And then this plan also has the lowest deductible amount. So if you're conscious for costs that when you seek care, that's going to be your lowest out-of-pocket costs when you actually use the plan, not necessarily out of your paycheck. Then you have the high deductible health plan with the HSA. This also uses that high-performing Local Plus network. It's great when you are a consumer because if you were asked to get an MRI, you can have 2 MRI places right down the street from each other. They can use the exact same MRI machine. One facility may charge $2,500. Another facility may charge $800 for that same MRI. So by having all of your care go toward your deductible first, it helps make you a better consumer by checking some of those prices before you go. I know if I was asked to buy anything and had that much difference in cost and I knew I'm going to get the same results, I'm using the same machine, I would rather spend $800 of my money than $2,500 of my money. So make sure you're being a good consumer when it comes to really any of the health plans, but it especially impacts you on the high deductible health plan. And then this plan also has a health savings account, or HRA, or HSA, that's tied to it. An HSA, both the City of Dallas contributes on your behalf, but you can also contribute to your HSA, and those are pre-tax savings. The HSA plan goes with you. So even if you were to leave the City of Dallas, any money that's been deposited into that account becomes your money that you can either use when you need to seek medical care, or you can save it and let it grow, and then maybe at a later time, if you have a more major medical event, you already have money set aside in that account that you can use. Remember when you're checking the network, because you do have 2 different networks depending on which one of the plans you elect, when you're contacting a facility or a physician, do not just ask them, do you take Cigna? Because generally they will say, yes, we take Cigna. Cigna has a multitude of networks to choose from. So just because they're on one Cigna network doesn't mean they're on every Cigna network. So you want to make sure when you're calling that doctor facility that you're asking them, are you contracted with Local Plus network? If I'm on the HR, or if I'm on either the premium copay plan or the high deductible health plan. If I'm on the low HRA plan, I'm going to ask them, are you on the Cigna OAP network? Are you contracted with the Cigna OAP network? That way you can make sure that you don't have any frustration of then going to the doctor, making the appointment, handing them your ID card, only to find out that they're not in the Cigna network that you're in based on your plan. So make sure you're asking those questions. So we've talked about a lot of different savings plans, and they can be really confusing of which is the right plan, which plan is tied to the medical plan that I'm on. So we have a little slide. I'm not going to read through everything, but to highlight some of the difference between all of these pre-tax plans. The first one is your health reimbursement account, or your HRA. This plan can be used for medical and prescriptions. Now keep in mind, when we say prescriptions, we mean a prescription that is written out by a physician. There are some medications now that you get at the pharmacy counter, but they don't require a prescription. So sometimes you can get that Sudafed, Claritin D, Mucinex D, basically anything with a decongestant. You have to get at the pharmacy counter, but you don't have to have a prescription. This is talking about something, a prescription that a doctor actually wrote out for you that you have to get at the pharmacy. So this HRA plan is tied to the HRA medical plan. The next plan is a health savings account. That is tied to the high deductible health plan. As a reminder, that can be used for medical, prescriptions, dental, or vision. And the HSA plan, that money goes with you. So if you ever leave, once that money is deposited into your account, that money now becomes yours. The third option is the medical flexible spending account, or a lot of people refer to it as an FSA. That is money that you, as the employee, contribute to on an annual basis, and normally it's divided up by the number of paychecks you have per year. That can be used for medical, prescriptions, dental, and vision, and that is tied to either the HRA plan or the copay plan. That's also a use it or lose it plan, which means that whatever money you put into that account, if you don't use it by the end of the year, you forfeit or lose that money. So you want to be careful about how much money you set aside in your FSA. The very last one is a limited purpose flexible spending account. That account is specifically designed for the high deductible health plan with the HSA, and that is only used for dental and vision services. So now let's talk about some highlights on your dental plan. So you have 2 dental plan options that are offered to you, both through MetLife. You have the DHMO plan, which has managed care dentists in it. That one, you need to pick a dentist. So you are choosing a primary dentist that you're going to use to seek care, and then that dentist has to provide you for a referral if you need any additional care. So say, for example, I go into my dentist. He says, you need a root canal. I'm not happy about it, but I need it. But he says, I don't perform root canals. I need to refer you to another DHMO dentist that will handle that root canal for you. This plan has lower out-of-pocket costs, not only in your paycheck deductions, but also when you actually use the plan. Every covered ADA service code has a copay associated with it. So before you go into the dentist's office, you know exactly what your patient responsibility is going to be. This plan also does not have any annual maximum, so it's a great plan if you need a lot of dental work done, if you're willing to pick a dentist from that managed care network. So if you haven't been to the dentist in a while, no, you have a lot of care, this one has no annual maximum. You continue to pay what those copays are for any covered service. The other plan option that you have is the PPO plan. That has both in and out-of-network benefits. So if you say, I have a dentist I've been seeing for 20 years, I don't care whether he's in-network or not, he or she, but I'm going to keep seeing that dentist. Likely, they may not be in the DHMO network, which means the DPPO is going to be the best option for you. It has allowed you to make that choice. That also means that you're paying a little bit more for that choice, both in your premium deductions and when you actually use the plan. This PPO plan also has an annual maximum of $1,750. So the maximum MetLife will pay out in any given plan year for services is $1,750. So just keep that in mind, especially if you have a lot of dental work that needs to be done. The same thing applies on the dentist when it comes to MetLife. If you are calling a dentist office, do not ask them, do you take MetLife? Because again, they will likely say yes. You need to ask them, are you contracted with MetLife DHMO, or are you contracted with MetLife PPO? Because that lets them know whether you can see them, for one, if you're on the DHMO, and 2, whether you're going to be covered for in or out-of-network benefits. So now I'm going to hand it back over to Cheryl, who's going to go over some of the plan enhancements that were made in 2019 and some of the proposed plan enhancements for 2020.
So in terms of the enhancements, we've already had a question about the wellness incentive program that's currently in place, the engagement organizational Janet's team is going to be working on the wellness incentive program and really coming up with something that is going to focus on prevention and really improving access to care and wellness and really enhancing or complementing the current health plan structure. The increased clinic access. You all heard that we do have Care ATC on site, but you can also access CVS, Minute Clinics, Baylor, Methodist Clinic, Care Now, and Concentra. So those are still available to you currently. Also, Care ATC has a direct line, so you don't necessarily have to go through a tree in order to reach the providers at Care ATC. And they will check vitals all day. I know your blood pressure does not rise in the workplace, right? That doesn't happen to anyone. But if it does, you can have your vitals checked at Care ATC. The introduction of the high deductible health plan with the HCA, that was a benefit that we offered this year as part of the 2019 plan. And then some of you may not know, but if you have been diagnosed as diabetic, there's no charge for your prescriptions. So again, these are enhancements that are available to those of you that are enrolled in our plans now. For 2020, again, proposed enhancements pending council approval. The premium copay plan. You saw the red and the green, a lot of great benefits for that premium copay plan for those of you who really want to have an idea of what your expenses are going to be. An increased HSA contribution. Again, the HSA helps to increase consumerism and actually reduces your expenses as well. The Employee Wellness Incentive Program, which we've talked about to increase participation, and then the increased clinic access. So I don't know if you all noticed, but to actually go to the clinics, the copay that we are hoping to be able to offer pending approval, it's $25. And that is just amazing. And then, of course, we will continue to expand access for Baylor and Methodist for a coinsurance of 20%. It would actually be 10% next year pending approval. Now it's 20%. So those are just some of the enhancements that we have coming our way pending approval from council. In terms of the next steps, we're going to continue to engage your feedback and your input. These sessions were designed with your input in mind. We're going to continue to do that because these are your plans, and we want to make sure that whatever we are proposing or presenting for approval is reflective of what you all envision and what you need not only as employees but also for your families. The proposed medical plan enhancements, importance of age-appropriate screenings and having a medical home. That's going to be really important for 2020. We talked about phasing out the HRA plan. It's been around a long time, but in terms of enhancing and providing you with access, there are some better options available now for our active employees as well as our pre-65 employees, and then the clinical wellness program incentive strategy. All of the new plans will be effective January 1st of 2020. The other piece that we are spending a lot of time on is the employee assistance program and making sure that what we are offering, one, is accessible. It is helping to meet the needs for you and your families, and it includes the diversity of services that are needed and are offered at other workplaces because we want to make sure that you're getting the best and you're getting quality just like any other workplace would that has 23,000 covered lives. So I am going to step away now, and we will actually hear from Janet and Janet's team. So, Janet.
Thank you, Cheryl. Good afternoon. I'm Janet Malassaw. I am Assistant Director in Human Resources, and my areas, as Cheryl mentioned, are employee engagement, organizational development, well-being, and communications. And I want to welcome all of you who came in person, also welcome all of you who are going to connect online and be able to take a look at this material. This is a lot of information, but the cool thing about having it posted online is you'll be able to go back. Certainly I'll be able to go back and re-listen to some of these things in case I maybe missed a comment here or there, or just want to make sure I really understand the benefit. But I hope it was helpful to you to have this overview and to really understand how the benefits work when we're not pressed for open enrollment. That's one of the things I'm really liking about making these presentations at this point. So in addition to what you're hearing here, employee engagement, employee experience is something that's really at the forefront of our minds. It's something that we think about because we're really interested in figuring out ways in which we can engage employees, we can hear from you directly, we can understand what you want us to focus on, the areas that are most important to you, that will really help make your experience at the city the best it can possibly be. And obviously for each of us, our experiences are going to vary a little bit, but maybe there are some ways in which we can think about that across the board, think about all of our employees across the variety of different departments that we have. So we are introducing here and at each of our benefits information sessions a citywide employee engagement committee. So Vanessa Gray, HR manager, will share with you more about this exciting engagement opportunity. Vanessa.
Well, hello. As Janet said, my name is Vanessa Gray. I am the Diversity, Inclusion, Culture, and Engagement Manager for the City of Dallas. And it gives me great pleasure to talk with you this afternoon about employee engagement, because engagement does matter. Engaged employees work with passion because they love what they do. Engaged employees feel a profound connection to the organization where they work. When you love what you do, it's not work, right? Right. Employees who are committed and invested and love what they do give their best at work and often find themselves going the extra mile and not thinking anything of it. Engaged employees drive innovation. They think of new ways and better ways to provide service and automate processes, and that is what it's all about if we're going to grow and change. If we keep doing the same old thing, the same old way, we'll always get what we've already got, and that's not what we need. We got to move forward. Helping the organization move forward is very important. We are the 7th largest metropolitan area in the United States and the 9th largest city in the country, so we have to remain competitive, including in the offerings that we provide to our employees. Higher engagement can improve productivity and increase organizational performance. The City of Dallas is laser focused on boosting employee engagement, and we need your help. This isn't something that we're wanting to do alone and in a bubble. We want your help. We need you to take this trip with us. As we facilitate engagement to improve the employee experience, the climate, and ultimately the culture, there are a few places that we want to start. First, we need to hear from you, our employees. And to that end, as Janet said, we're creating a new employee engagement committee, brand spanking new. This committee will involve employees in reviewing and designing systems, processes, materials, etc., that employees will receive and will choose to go forward with. The team leaders from Human Resources will make accessible information to you to help you make decisions, and it'll be easy to understand. We'll share industry standards and backup data and documents to enable the committee to determine the direction of future initiatives for the city. So again, we need you to help us. Help us simplify the way we do business whenever possible. Where processes are perhaps cumbersome, have too many steps, let's streamline, or better yet, let's change those processes. We are firm believers that it's important to look at data and trends and employee data wherever possible, employee input wherever possible. So again, you'll help us make better and more informed decisions versus, again, Human Resources or someone else in the city making decisions in a vacuum without you. The Employee Engagement Committee will focus on climate and culture enhancement, thereby relying on you, again, to improve the overall employee process and experience. You might review things such as benefits and wellness components, employee recognition, professional development, communications, diversity and inclusion, leadership development, performance management, and the list goes on. All of these programs, again, are a large part of the employee experience. As you can tell, the employee experience is not just one thing. It includes the job, what the work is like, the team, the management, the culture, the overall environment, the diversity and the inclusion, and the ability to advance and learn. All of the things that go with the life of employment. When employees have a better experience and improve the climate or culture, our work life is better, and we become happier and more satisfied. Wouldn't you agree? Well, if that is the goal, let me share this with you. What satisfies people the most is doing meaningful work, making progress, and getting something done. A noted author, Arthur Burson, said, "Most people don't come to work for the entertainment. We come to work because we like the job, the organization, the manager, or the customers, not just because we're getting paid." So again, investment in what you're doing. All of this happiness and satisfaction leads to just one thing. Again, a better experience not only for the employees, but for the citizens of Dallas, and that is why we're all here. The Employee Engagement Committee will meet quarterly. We'll have working subcommittees. Those will provide training as well. And then the subcommittees will meet minimally for a half day per quarter. The Engagement Committee will meet once a quarter for up to one full day in length. So again, you're going to be trained on what it is that you're going to do. You'll have ample time to meet, and we're going to provide you with the data and the documentation, or if there are things that you think you need as a committee, you can ask us and we'll do the legwork and get that for you. The purpose of the Engagement Committee is to work collaboratively with city team leaders and provide engagement and recommendations to human resources and other leaders in the city to increase engagement, improve organizational effectiveness overall, and impact continuous ongoing process improvement. You might research and advise organizational executive leaders on new, innovative, and best practices for engagement. So again, extra legs, extra arms, extra help for human resources to do a great job in this organization. And you'll review HR offerings and provide feedback. So data that's going to go forth to employees, brochures, pamphlets, programs, what have you, you'll be cutting edge working with us on that. Ultimately, you'll review the forthcoming employee engagement survey. That's planned for next year. And whatever the feedback is, you'll help us make decisions about how to implement and address the deficiencies that might be identified. How do you get involved? Well, I'm glad you asked. The application process actually opened last week, and it will conclude Monday, June 3rd. So you've got a little time left to apply. We have hard copy applications here with us today. They're available online on the intranet. We have an Employee Engagement Committee sign. You can go take a picture of the QR code and apply online. So we've got several different ways for you to get involved with us. Decisions or selections will be made by July 8th. You'll be notified via email if you have email access. If not, you will receive a letter to the address that you put on that application notifying you of your selection. If you have any questions about this committee, please email dallasdiversity@dallascityhall.com. Now, again, on the end of employee engagement, something new and different that we're doing, we had an employee health fair last week, and we had outstanding turnout. It was organized around making our employees well-rounded, or ensuring that our employees are well-rounded, and it focused on the 5 pillars of life, 1 being physical, 2 spiritual, 3 financial, 4 emotional, and 5 social. We received great feedback, and as a result, we're going to make this an annual event that you can look forward to. All of our community partners, both educational and health vendors, were there. They provided good information, nice trinkets and giveaways, and again, employees were engaged and left with a better sense of well-being. As we round to a close here, in summary, city leadership is interested in your involvement and feedback, and here is your chance to participate. You can self-nominate or be nominated by your department. If you're nominated, you still have to complete an application, though. There'll be 1 employee selected per department, unless you work in a large department of more than 1,000 employees. In that case, there will likely be more than 1 representative. Again, the application period is open until June 3rd, and you'll be notified by July 8th. Again, any questions, email dallasdiversity@dallascityhall.com.